To News Hour live on GBC News and Governance. My name is Micheline Taka, and we are also live on GTV and Obonu TV and on Facebook at Ghana Broadcasting Corporation. In recognition of their hard work in the fight against spreading COVID-19, GBC News has dedicated all the 7 p.m. news bulletin in June to our frontline workers. Now, to help us with today's broadcast, I have 3 frontline workers with me in the studio. She is?
I'm Dr. Diana Nakowa at Trust Hospital.
I'm Dr. Gabriel Ganya, the Kolebu Teaching Hospital.
I'm Nurse Bibiyanki Dankwa, Beach Hospital Emergency.
Wow, nice having you all here with us today to read the news. How has the fight against COVID-19 been for you as frontline workers so far?
Well, the challenge is that as health workers, you definitely have to get close to your clients as you attend to them. And as a human being, you also feel anxious knowing and seeing what is going on around the world with COVID-19. So it's a big scare even for us as health workers.
Doc?
The ever-changing face of COVID-19, you can't say you've known all the protocols. It keeps changing and you have to keep abreast with the epidemiology and the changing face. It doesn't make it very, very friendly.
Can you share yours with us too?
Okay, so COVID-19 has come to stay for that I know. We have to find other ways to help our patients with our care.
We wish you all the best in your endeavor and your fight to ending coronavirus. Now the news in details. They will take us on.
Delegates of the New Patriotic Party have voted to elect parliamentary candidates for the upcoming 2020 general election.
The elections were conducted in 168 constituencies. Of the 374 aspirants who contested, 65 went unopposed. Here are the confirmed results by the Electoral Commission.
Esunafo North constituency, Evans Opoku Bobie had 675 votes. Techima North, Martin Otija, 346 votes. Aguna West, Cynthia Morrison had 584 votes. In Kranza North, Major Derek Ojo had 237 votes. In Kranza South, Charles Konedu had 438 votes. In Fansman, Eko Kwansa Hayford had 611 votes. Wenchi, Prof. John Bafor had 172 votes. In the Anya Soutuom constituency, Dixon Adumako Kisi polled 324 votes. German South, Prince Yabua Mafo polled 253 votes. Etrima Kwawan constituency, Amankwa Opoku polled 415 votes. In the Mapon constituency, Kweku and Prechum polled 295 votes. In the Snafo North constituency, Evans Opoku Bobie polled 675 votes. In the Asante Akim North constituency, Andy Apiakubi polled 501 votes. In the Esutufi North constituency, Patrick Bano polled 189 votes. In the Subin constituency, Eugene Entry polled 485 votes. In the Manso Nkwanta constituency, George Obin polled 217 votes. And in the Tolon constituency, Habib Idrisu polled 338 votes.
And in the Kumeru constituency, Philip Baswa won by 184 votes. In Wa East, Salifu Yakubu, 214 votes. Ejiso John Kuma, 397 votes. Sunyani East, Kwesi Ameyachireme, 605 votes. Suhum constituency, Kwedo Asante, 394 votes. Ablekuma North, Sheila Batel Sams, 518 votes. Domi Kwabenya, Ajua Safo, 496 votes. Bantama, Asenso Boachi, 456 votes. Okaikwe South, Dakwa Newman, 440 votes. Adenta Yao Boabeng Asamoah, 422 votes. Navrongo Central, Tangoba Abayege, 307 votes. Tema East, Titus Glover, 522 votes. Tema West constituency, Carlos Ahenkra, 593 votes. New Joabin South, Michael Ochrebefi, 372 votes. Achim Oda, Alexander Akum, 215 votes. Joabin. Ama Poma Boaten, 192 votes. Asante Ochem South, Asante Boaten, 360 votes. Kwesimintim Prince Ama, 222 votes. Okaikwe North, Issa Fuseini, 305 votes. Yendi Farouk Ali Mahama, 244 votes.
At some of the polling centers, 65 MPP parliamentary candidates went unopposed and were acclaimed by delegates of the party in the various constituencies. Here is the breakdown. At some of the polling centers, 65 MPP parliamentary candidates went unopposed and were acclaimed by delegates of the party in the various constituencies. Here is the breakdown.
President of Ghana, Nana Akufo-Addo. Congratulations, 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 congratulations.
To Akim Oda, Ahmed Atta, Okaikwe South, Kofi Brako, Tema Central, Colin Amankwa, Benshia North, Ben Abdallah Banda, Offenso South, Patrick Adama, Sisala West, Godfred Bayong Tangu, Wa East, Ridwan Abbas, Sisala West, Kwabna Ohemen Tinyasi, Kede, Kwabena Owusu Eduomi Ejisu.
Ghana has stepped up her capacity to meet the demand and needs in the fight against the current and future epidemics and pandemics. Her test case, therefore, is the first ever 100-bed capacity infectious isolation and treatment center under construction for COVID-19 isolation. GBC News' Clara Mlano was at the facility at the East, which has seen a modification in the master plan, upgrading it to a more modern facility.
An increase in labor, extension of completion date, and more work to execute for the timely completion of this facility for the country's treatment and management of the novel coronavirus. It was designed specifically as a 100-bed capacity infectious disease isolation and treatment center. But that plan has changed. New additions: a 21-bed intensive care unit, a 2.5 level scalable to a level 3 biomedical laboratory, and a total insulation of the center for energy efficiency on the request of health experts have been incorporated into the architectural design.
This is an intensive care unit of the hospital. This is the part that we added to the facility. It's a 21-bed facility. It's made up of 3 groups of rooms. We have single isolated rooms, which is here, which actually takes 1 person per room. So these rooms here, this will take 1 person, actually another person here, isolated ICU, same as that. So it will take 5 people in here. So this is isolated ICU. Nobody comes into this area apart from the patients and then the medical staff.
Who brought up that idea that we should have?
You know, because of the infections and then the pathogens and other things, you have to be careful of the kind of system that you use for air conditioning and other things. So this air conditioning system is not mixed with the others. It's actually segregated. So this ICU is for the patients who are actually under a certain high medical condition. So they need special medical care. So we put them in intensive care units. Maybe having some underlying medical conditions. That's why we bring them here and we look after them. They are different from the main wards that you see. So these are single areas.
Work on fittings, ceiling, paintings are all being executed concurrently. As part of the new additions, there is an application of an ultraviolet radiation treatment for air entering and exiting the facility, which is to ensure that no contaminated air escapes in the building.
This is how we are finishing this room, and after that we are going to have the primer and then we are going to have the epoxy floor. The reason I'm using the epoxy floor is because you need to have a jointless floor finish, okay, so that you don't have any infections or any actually bacteria hiding in the corners of the floor. This is seamless, there's no joint, there's no mark anywhere. You can see from the walls that there's a curve, what we call the coving. So those coving there allows you to do easy cleaning. So for such an area that you're using a lot of chlorine to clean, you don't have any dirt in the area that will actually lead to contamination. So this area, this room here is a 6-bed unit. You have 3 beds here, 1, 2, 3, coming here, another 3 behind this way. Then you have an inner room for a 4-bed. So all in together, this area is actually a 10-bed.
The structure is being put up to outlast COVID-19 with a long-term benefit to treat other infectious diseases such as SARS, Ebola and meningitis. With reports that most of the country's isolation and treatment centers are bursting at their seams, this will become the ideal facility for use.
Anyone at all, if you feel you need to help a COVID-19 case, you can also donate for this facility. This is a one-stop, one-of-a-kind facility, which we call an infectious disease isolation and treatment. And it's 3-in-1. It means it's a disease center. We isolate the patient and then we treat the patient. So as much as possible, anyone that you can support with anything to help this facility come up and complete, we'll be most grateful.
Of the over 300 military and civilian workers on site, is the only female electrician at the construction site. Her duty is to undertake the electrical works at the facility, and this, I'm told, is being done with an eagle's eye, because any slip will greatly affect the smooth running of the center.
She knows her stuff. She's doing the wiring up there on the cable tray systems that brings all the power into this room, and she's been at it since we started the project. We are doing main wiring here now. The wiring system here is very, very technical and very key. If you miss any of the wires, you're going to have a wrong relay feedback into the main system. So for all the patient monitors here, all the sensor systems, that's what she's doing up there. And there's a 6-bed ICU, 3 beds here and 3 beds there. So you can see the windows are up, you can see from here, windows are finished here. Once she's done there, they'll finish by this evening. We'll close out the ceiling and start with the completion works of painting. So up there you can see the medical gas systems that are coming down to form the bedhead units. So this will give oxygen to the patients through what we call a bedhead unit, a BHU, which will fix on the wall, which also in the holding area outside. So also than that, we are good to go. Very soon, at least we'll have our first patient here.
To be part of the team, trying to build up this big project. So I'm happy to be proud of that.
The intermittent rains have slowed down ongoing works here, eating into their time. Managers admit work is tiring, but are confident of a positive outcome.
This is the main frontage of the center. We have basically the ambulance entrance, which we are casting now. This forms the last wet works to be done. We finish it by today and there's no concrete to be cast anymore. And I raise the columns and then we start with the main entrance with a glass shield. So basically this is the main entrance. To my far right is where we have the level 3 laboratory that we added. So this way we can test from here. Our samples can be taken and then tested in that laboratory, and then you can be diagnosed way behind those doors there, or that white wall, where you have triage areas to separate the people into various categories. On my left side, we are finishing up. It goes down, we add a walkway to it that goes down around the building. And then for visitors entrance also at the far end there, that completes the external work. So as you can see, we are fired up and geared up to finish the works.
Funded by the Ghana Covid-19 Private Trust Fund, this center, the first of its kind in West Africa, when complete, will be Ghana's national coronavirus treatment center and will enhance government's ability to deal with the spread of the coronavirus and other pandemics. For GBC News, Clara Mlanu reporting.
The world marks Sickle Cell Day with a focus to combat the disease through stakeholder support. At an event to mark the day at Tema, a sickle cell advocate, Madam Charlotte Owusu, said early diagnosis helps to prevent passing the sickle cell gene on to unborn children. Hence the need for prospective couples to conduct sickle cell genotype tests to know their traits and status.
The theme for this year's commemoration of the World Sickle Cell Day in Ghana was Sickle Cell is Preventable, Know Your Sickle Cell Status. This sought to create the awareness of the need for the public to undergo sickle cell genotype test, understand the condition and related causes. As part of the celebration, the Sickle Cell Prevention Advocates in partnership with the Tema Clinic screened people for sickling in addition to other health conditions. A sickle cell prevention advocate, Madam Charlotte Owusu, spoke about the significance of the exercise.
We have a population of about 28 to 30 million. About only 25 people are affected. And then the 75 people out there can be, if they know, and the others who have the condition or are carriers know their status, they can easily partner the 75 people out there so that they wouldn't ever have children with sickle cell. And we can easily get sickle cell out of our system.
She said it is important to know one's hemoglobin genotype before choosing a life partner. A retired nurse and specialist in hemoglobin abnormality, Madam Comfort Champo, spoke about the problems associated with the disease and the essence of early diagnosis and prevention.
When your hemoglobins break down excessively, that's why they say they've got crisis. So if they break down, one, you haven't got oxygen in the body most of the time. And the red blood cells change into a circle shape or half moon shape. So they're not round anymore to be able to move in the blood vessels so easily. and you are in pain most of the time.
She entreated caregivers of sickle cell patients to report early to health facilities when they observe any changes in their condition.
The National House of Chiefs is to host traditional authorities from 20 African countries next year to deliberate on how to strengthen ties and promote peace and unity among traditional rulers in Africa. The President of the House, Togbe Afede, announced this at the annual general meeting of the House at Kumasi in the Ashanti region.
The House met to discuss issues including the new Chieftaincy Amendment Bill, enhanced allowances for members, requests by some regional houses to admit divisional chiefs, COVID-19, and the need to promote peace and unity during this year's election. President of the National House of Chiefs, Togbe Afede, called on all, including traditional rulers, to be circumspect in their utterances during the election.
Africa has 20% of the world's landmass, 30% of its known natural resources, 17% of its people, but we account for only 3% of global GDP and only 2% of global trade. The search for answers as to what we can do to help has engaged our minds recently, and we came up with a plan to initiate conversations with important traditional leaders across the continent. Ultimately and ideally, this should lead to the formation of a permanent continental body, say the Africa Traditional Leaders Organization, to coordinate activities of traditional leaders across Africa.
Togbe Afede said the House received some petitions from the public asking the traditional authority to prevail on the Electoral Commission to stop the compilation of the new voters register. He described the recent killings of Black Americans as inhumane and against human rights.
The Upper East Regional Director of Health Services, Dr. Winfred Ofosu, says it is not necessary to close the Pualugu Police Training School after 199 police recruits from the training school tested positive for the coronavirus. In responding to calls to close down the school, Dr. Winfred Ofosu said the infected recruits were stable and could fully recover within the next week. He said the affected students are in quarantine and isolated. Dr. Ofosu says the school has the needed facilities to cater for them.
The number of police recruits who have tested positive to COVID-19 in the Upper East region has increased from 86 to 199. The Ghana Health Service says the spike in the number of infections in the region was due to an outbreak of the virus at the police training school in Pualugu in the Talisi district. The authorities assured the public that the infected persons have been isolated and are receiving treatment within the premises of the Pualugu Police Training School. The Upper East Regional Director of Health Services, Dr. Winfred Ofosu, who spoke off camera, said calls for the closure of the police training school was unnecessary. The Upper East Regional Police Commander, DCOP Ose Ampofudoku, said mass testing among police officers at the Pualugu Police Training School and for all recruits forms part of measures instituted to curb the spread among the police personnel in the region. Meanwhile, results from a backlog of some 700 samples are yet to be made available to health authorities in the region. The Upper East Regional COVID-19 Treatment Center at the regional hospital is still closed. All the new cases recorded among civilians in the region are being managed at their homes.
At the Demekwa, Benya and Adenta constituencies, voting to elect parliamentary candidates to represent the new patriotic party at the 2020 elections was conducted peacefully. However, observing all the WHO protocols for safety against COVID-19 were non-existent.
Voting was peaceful at the time the news team got to some polling stations in the Kwabenya constituency. This is where the Deputy Majority Leader and Minister of State in charge of Public Procurement, Madam Sarah Ajosafo, locked horns with Mr. Michael K. Jr., Ghana's High Commissioner to India. The keenly contested election saw the incumbent Ajosafo winning by 8 votes margin. Ajo polled 496, while Mr. Michael K. Jr. polled 488 votes. At the Adenta constituency, there was heavy military and police presence. The incumbent member of parliament, Mr. Yawabian Samoa, was contested by 5 candidates. He however won by 423 votes, followed by Mr. Emmanuel Kwesimante, who polled 217. Frida Ajeman Sapon got 7 votes, Mr. Rahman Jack 87, and Mr. Alfred Abebiokumi 10. Mr. Yawabian Samoa could not hide his joy.
I feel exuberant and I'm happy. 2020, we will win massively, maybe twice more than we did before.
Alhaji Boniface Sadiq, who went unopposed, was grateful to his constituency members and the entire party.
I believe that, well, my constituents, my electorates and the people in Medina thought it would be better to give me the chance to go the second term so that we will be able to bring a lot of development within the constituency.
The news team, however, observed that there was no observance of any of the anti-COVID protocols. There was not a single Veronica bucket present at almost all the polling stations visited. Neither was there adherence to social distancing. For GBC News, Heiga Usu reporting.
About 1,800 people cashew farming within the last 2 years in the Ejisu Setredumasi municipality of Ashanti, with authorities hopeful of more people joining. The farmers attribute this to a brighter prospect for enhanced economic value in the near future, in addition to government's initiative of the Planting for Exports and Rural Development PED program. This seeks to provide free cashew seedlings to interested and prospective farmers to either start their business or expand their existing farms.
Unlike many of the 43 administrative metropolis, municipalities and districts of the Ashanti region where cocoa production is prominent and a major agricultural activity, the Ejura-Setredumasi municipality does not have the conducive climatic condition and vegetation cover that supports production of the crop. Ejura-Setredumasi lies within the traditional zone of Ghana's ecology. It is made up mostly of settler communities whose mainstay is annual crop farming without the advantage of any cash crop that could offer them future economic guarantee. It was not until the late 1990s that the ecology was found to be very suitable for the cultivation of cashew and production, which started on a small scale. The Adventist Relief Agency, ADRA, a humanitarian wing of the Adventist Church, which introduced cashew, locally known as ATIWA, as a cash crop to the area, encouraged large-scale farming, with some people taking advantage of it, but the number had not been encouraging. But compared to cocoa, cashew farming is less stressful and capital-intensive. 46-year-old Mr. Kwekudua, the 2018 Ejura-Setredumasi municipal best farmer, ventured into cashew farming about 15 years ago to augment his commercial agricultural production. He took GBC News through what it takes to cultivate cashew on commercial basis.
yes, but it's a free Busumi Dumiunum, a woman's copy Busumi Siam and the cruise.
In the past few years, the people in the Jurassic Dumasi have embraced cashew due to the impact it has had on the socio-economic lives of farmers in the community. This has compelled a good number of farmers to switch from other cash crops to cashew on a large scale. Furthermore, the introduction of government's flagship program of planting for export and rural development (PED) is serving as an impetus to the business. Since the introduction of PED, cashew in 2018, more than 1,800 individuals have taken advantage to go into large-scale production of the crop. The municipal assembly produces nurseries and supplies the farmers with free seedlings to serve as an incentive to attract especially the youth to be economically empowered. One of the many beneficiaries of the PED is 56-year-old Madame Diana Osei, who has expanded her cashew farm and is still looking for an opportunity to expand. Mr. Kwekudia and Madame Diana Osei said though there are some challenges involved in cashew farming, the benefits outweigh the downsides. The cashew desk officer of the Ejurasa Chiridumase Municipal Agriculture Directorate, Mr. Fuseini Buliga, was satisfied with the level of enthusiasm of the people to venture into cashew commercial farming, but urged opinion leaders in the community to join hands in educating the youth to get on board the PED program in order not to derail the progress made.
European Union, European Commission, sorry. So we write proposal to them. Unfortunately, I think in Ashanti we are the only municipality that actually qualify. So we had support from EU to ATIWA to also expand the PED program. But the name of that program is not actually PED, but rather BAT. So we are doing that. Fortunately too, the Ministry of Local Government and Rural Development selected our municipality as part of the beneficiaries of SEKYERE. And the safety net alone this year, we have a target of 100,000 cashew. But looking at the situation, it's likely we are going to exceed the target. We are looking at 120 or 130. Here we are now about half a year and we have done 85,000 already. So looking at the remaining time, I believe we can do more than the 100,000 that was projected.
Forecasting the outlook of cashew in the municipality, the Ejurasa Chiridumasi Municipal Chief Executive, Mr. Salisu Bamba, predicted that the municipality aims at becoming Ghana's cashew farming and processing hub by the next 10 years.
Government should try and push through the policy of the Cashew Development Board so that there can be fixed prices for the product like the cocoa, so that if the farmer is going in for the production, he knows that if I'm able to get 1 bag, kilo is this, so that if he goes to the marketing center, they will be buying the products by volume.
The MC therefore appealed for patience among the farmers as government and its partners are taking steps towards addressing their post-harvest concerns such as reliable markets and pricing. Ghana's total production of cashew in 2018 stood at 50,000 tons, and government has proposed the setting up of a cashew development board to address pricing and marketing of the commodity.